Good late afternoon. The topic is economic and other consequences of COVID-19. Where are we and how did we get here? I thought I would talk for 30 minutes or so, and then we would go into questions and answers. Some of your questions I will know the answers to. Others I will not. Where are we now? With respect to the disease, we now in the United States have 1 in 1,700 people dead of it, heading for 1 in 1,000 dead by, to pick a date at random, January 21st, 2021. That would be 330,000 deaths. Those countries that I think of as our peer countries, the ones to whom we should be comparing ourselves, have many, many fewer deaths. They are on a trajectory that will bring them only a few more. Canada's death toll currently is 1 in 4,000. All of Ontario had only 2 coronavirus deaths last week. An intelligent man I think of as a rabid right-wing hyena, David Frum. He who coined the term axis of evil for President George W. Bush, the biggest Iraq war booster I know. He does an interesting column. He has an interesting column in The Atlantic this week. He muses on crossing the border between New York and Canada. He calls the U.S.'s response to the coronavirus plague a state of denial. I made a tiny URL link to his piece. Tiny URL, and then after tiny URL a slash, and then after the slash we go a lowercase d l dash 09 dash 09 lowercase aa. Or simply Google David Frum, and I crossed back into a state of denial. It is worth reading, if only for what we could have been done and could be doing to deal with this first serious plague epidemic in a century. But I'm here to talk about economics. And let me start with the rhythm of employment in the American economy in a year, in a typical year. In the American economy in a typical year, we lose about 3 million net jobs at the very start of each year as the economy steps down from the Christmas rush and construction shuts down in the north. Then, throughout the spring, the U.S. economy adds workers. The U.S. economy adds workers until the month of July or so, when we have another loss of employment as people step down for the summer. Then, after the summer, employment picks up again. We head for the Christmas rush. And then the cycle resumes once again. Now, there are other smaller disturbances that are superimposed on this seasonal cycle. The so-called Great Recession of 2008 and 2009, for example. There was no fall hiring boom at all in 2008. Rather, there was a loss of 1 million jobs. And then there was no net hiring at all, in the spring of 2009. No net hiring to recover from the post-Christmas slowdown until after Christmas of 2009. But March of 2020 was the first time ever since the payroll employment data series began that the seasonal cycle was swamped by something else. The collapse of employment in the United States at the start of last spring, when in 1 month 20 million people lost their jobs. That was March. And only a third of those managed to return to work in April and May. But starting in June, the bounce back largely ceased. If you have not gotten your job back by the end of June, the odds are really, really high that you still do not have it. And it is instructive to look at levels as well as changes. Consider the workers in the 25 to 54-year-old range. These are all people who are too old for large numbers of them to still be in school, and too young for large numbers of them to have retired. The seasonally adjusted share of American 25 to 54-year-olds who have jobs fell by 5 percentage points, from 80 to 75% in the Great Recession of 2008-2009, that was a big deal. That share fell from 81 to 69% by 12 percentage points in the early spring of 2020. And it has only recovered 1/3 of the way back, to where it was last February. This fall in employment naturally carried with it an enormous fall in production. By July, production in the U.S. economy was more than 10% less than it had been in January. We will, by the end of September, have made back perhaps half of this decline, if we're lucky. But it really looks like there the recovery is likely to stall, unless Americans decide to simply take the hit and spend work as though there weren't a coronavirus plague going on, or unless our government policy changes in a way to bring our performance much closer to performance in our peer nations. I try to track what is going on with the economy right now with 4 series. The weekly new unemployment insurance series, the weekly continued unemployment insurance series, and then 2 monthly series, the monthly personal income series and the monthly personal consumption series. They are here. Now, new unemployment insurance claims. They show the collapse of employment in March, and they show us that layoffs are still running at a very elevated rate. But now it is no longer businesses shutting down temporarily as they hunker down, hoping to reopen soon after the virus passes. It is rather businesses throwing in the towel, declaring bankruptcy, and permanently vanishing from the stage. I had huge hopes back in March and April that we could quickly beat the virus and get back to our February normal. Those hopes were vain. That is simply not going to happen. You could try to look at continued UI claims and treat them as telling you a more optimistic picture. Unfortunately, they are now falling not because people are gradually going back to work in large numbers, but instead because people are running out of benefits. It is important to note that the economy is experienced and is now suffering from not just a supply but a demand shock. It is somewhat, but not very much the case, that because of the plague there is less work that it is worthwhile to do, and so people are preferring leisure to non-worthwhile work. But there is also plenty of work to do. But we have not managed to start up and move those who lost their jobs in March into some of the work that was then left undone, but was then and is now worth doing and is now very much worth doing. There is not the demand to support such a large transfer of workers from sector to sector. Why is there insufficient demand? Because when the hunker down began, people decided to postpone a lot of spending until the day when they can resume normal patterns of activity without fear of coronavirus. And so we went from an economy that had $1.5 trillion per year of personal savings to an economy that had $3.0 trillion per year of personal savings. The government stepped in with the now expiring CARES Act to boost people's incomes, but that was not enough to fund a great worker sectoral transfer. Business investment did not boom to do it. We could boost government purchases to do, but this administration is not interested in an infrastructure year, or an infrastructure quarter, or even an infrastructure week. Now, as we all know, different people face very different risks from catching the coronavirus. It is not just a flu. It is much nastier than a normal flu in many dimensions. But it is true, not all that deadly to the young and healthy. For even the young and healthy, catching coronavirus is about as likely to kill you as is riding in an automobile like a normal American for a decade. So we could have decided to organize and simply bull through the coronavirus. A functional society could have decided to competently shelter the old and other vulnerable from close human contact and thus from infection, and to otherwise take the hit. It would have been very costly and expensive, but economic lockdowns are expensive too, and it would perhaps have been not a totally and obviously insane as a thing to do. Indeed, that may have been the policy of the Trump administration toward coronavirus. But it never organized the sheltering of the old and vulnerable, and it never said that was its policy, if indeed the Trump administration can be said to have had a policy. On the one hand, the Trump administration certainly highlighted its epidemiologists with their calls for suppressing the virus, as China, Japan, Korea, Taiwan, and Australia managed to do. On the other hand, you could be forgiven for thinking that maybe inside the Oval Office, the decision had been made to give lip service to the epidemiologist, but otherwise to simply take the hit. If this was the decision and the policy, the reasons would have been that the virus ripping through the population would, all in all, not have been all that damaging, while the economic damage from steps to seriously retard spread was very costly again. And here I think the Trump administration was very, very badly served by its economic advisors. The Kevin Hassetts, the Larry Kudlows, the Thomas Phillipsons, the Casey Mulligans, the Tyler Goodspeeds, and company. Truth be told, the economic epidemiological models the Trump administration preferred, that of IMHE, were not the best and were way too optimistic. But the economists then decided they could fit data better than the epidemiologists and cranked up optimism so as to predict that the plague would pass, as to when the plague would pass to the max. I still do not have an explanation of why they were so eager to take on issues when they were really not in their wheelhouse at all. One of our big problems is that we are not really sure where we are with the coronavirus plague. Even now, we should be testing as many people as we can for free and getting test results back within 24 hours to figure out where and how much the epidemic is and thus what realistically our options are for dealing with it or living with it. But we aren't. We think we are catching only about 1 in 15 cases. So all we have really are guesses about the true spread of the virus. For what it is worth, here are my guesses. Back in February and March, because of our complete failure to understand the situation, especially that the bulk of the spread was being done by people who were shedding the virus in large quantities but were not yet coughing and sneezing and did not yet have fevers, the virus was tripling in numbers every week. It looked as though we were heading for a world in which half the American population would wind up catching the disease in short order. That we went from a negligible number of cases in February to a peak March week in which perhaps 1.4 million Americans caught the disease and ambulance sirens ceaselessly filled the air in New York City. And our collective decision was to respond with panic. Justified panic, but panic. We knew next to nothing about the spread and little about the deadliness of the disease, hence the lockdowns and the crash of the economy that accompanied the lockdowns. Truth be told, only about 1/3 of the economic crash was a cost of the panic lockdown. 2/3 of the economic decline came from people's deciding to postpone spending until they could resume normal patterns of activity without fear of catching the disease. And the lockdowns did have an effect. They pushed new cases down by 60%, but had pushed them no further by the end of May. Then we were still having 600,000 people a week catch the disease, and of those we detected very few. And so we had only little sense of how many and where those cases were. And deaths were declining. Not to the near zero that Kevin Hassett's and Larry Kudlow's curves on graphs had suggested they would, but declining. And so, as soon as deaths began to follow cases on a downward trajectory, Donald Trump and his administration began to call for declaring victory and for liberating the country from evil and power-mad Democratic governors, like Michigan's Witless Whitmer. Don't make the cure worse than the disease, was what I kept hearing. Don't exaggerate the situation. And so, come June 1st, the second wave began. And now looks to me like the number of true cases doubled in a month and a half. And it is in June and July that Massachusetts, Connecticut, and the rest of New England and New York began to diverge from the rest of the country in a good rather than a bad way. They now look much more like Canada or Germany than they look like the rest of the United States. And the state governments, those that could have recognized in mid-June that the cases were no longer in a downward trajectory and that more action was needed, they turned into ostriches, as did Trump's White House and his people in the CDC. And so in late July, we had our second turn. Yes, we had some governors shutting bars again. Yes, we had some governors pleading with people to wear masks and stay more than 6 feet from others and avoid going into anything that looked like the bat caves that coronavirus evolved in and loves so much. That this was not a partisan issue, but instead a good Christian, be good, kind to your neighbor issue. But mostly it was Americans. Americans figuring out that while wearing a face mask probably would not protect you, wearing a face mask probably would protect those you came in contact with during those 3 days while you were infectious and before you had symptoms. And so by the end of August, I think the weekly new caseload was back down again. Not all the way back down to 600,000 a week, but, maybe 800,000. And then the school year began. I have been pleasantly surprised by the fact that school opening does not appear to have triggered another doubling of the caseload yet. But there has been a slackening of mask and social distancing discipline across the country, and there are a lot of young people crowding together in schools, catching the disease, and they will then transmit it to old people, some of whom will die. Professional sports with near infinite money cannot keep a firm lid on this. So I believe we look forward to a fall of more of the same. About 1 million new true cases a week. But because we catch only 1 in 15 of them with our inadequate testing, we do not really know where or how many in time to take effective, even semi-tuned efforts to put the virus again on a downward path. And with those 1 million new cases a week, it looks as though risks of infection are too great for the people who have cut back on their spending, to decide that it is time to take the risk, take the hit, and resume normal spending. So I do not see where a further economic recovery this fall in the United States will come from. Stepping back, so far our performance relative to the countries I think of as our peer countries has been absolutely disastrous. The United Kingdom is the only peer country that has done as badly as we have. Yes, Italy and Spain have done worse so far, but not as bad as Spain in terms of public health and economic performance is something I would have thought of as a low bar back last February. Australia, Japan, Canada, Germany, Switzerland, Norway, etc., all look to have this thing effectively suppressed and all look likely to have very strong economic recoveries this fall. As I said at the start, Ontario, 2 coronavirus deaths last week. And they test enough to catch their cases. We do not. And until we do, until we have rapid, comprehensive, free, immediate response testing, we will not be able to understand where we are with the plague in time for us to effectively manage it. Now, suppose we wanted to match the performance in handling this plague of our peer countries. What should we do? Well, if Trump had been smart, last February he would have reached out to Harvard's Jim Stock, who had been one of Obama's economic advisors, who is the best and broadest economic statistician I know. Better at figuring out what data to look for and then teasing out what conclusions for policy it suggests. The Kudlows and the Hassetts, the people Trump had, were really out of their depth. As one of my acquaintances in the Trump administration said, what did you expect? Kudlow made his career telling investors what they wanted to hear, and Hassett made his career telling Republican politicians what they wanted to hear, and that's not what President Trump needed last February or March, or needs today. Now, Jim Stock says that we do not need to lock down the country again. That was a panicked response when we did not know much. But we do need to work from home as much as possible. We do need to spare no expense to protect the elderly and the vulnerable. And we do need to make all of our jobs as far away from being people in close contact in a bat cave as possible. And we do need masks and social distancing. Those do a lot to prevent trouble during the 3 initial days of asymptomatic transmission. But if we were, as a country, doing that, and by the avoid bat caves principle, avoiding bars and large social gatherings, we could be Canada in a month without another full lockdown. Plus, of course, we would need testing, contact tracing, and quarantining at a level intensive enough to actually do good. I told you at the start to read David Frum. Now I am telling you to go read Jim Stock. tinyurl.com/lowercase d-l-2009-09-b, or Google James H. Stock and lockdowns are too blunt a weapon against COVID. One final point. I sometimes hear the stock market. It's really high. Yes, it's a horrible disease, but if it were really that bad for America as a whole, why is the stock market so high? But a high stock market can mean that the future is bright, or it can mean that the future is crap. And so it is worth paying a fortune for anything that promises to give you even some income in the future. Current values are high. Expected cash flows as a proportion of capital invested, are those high? Really? That, I think, is the measure to watch. So thank you. And I have talked for more than long